Chapter 2: Normal Pregnancy Changes. Now we will talk about what symptoms you'll be experiencing, what are the normal pregnancy bodily changes, what things to avoid, and things to enjoy. You can expect a range of physical and emotional changes during your first trimester, as this is when your body is experiencing the most change. Starting from the first trimester, you'll probably feel more nauseated and even have episodes of vomiting, what many women call morning sickness. Don't worry, as this is completely normal and it affects up to 90% of women. The exact reason for this nausea is not known, but is thought to be due to multiple causes, including pregnancy hormonal changes, increased reflux, and slower digestion. This nausea should improve after the first trimester. Although not backed up by the strongest evidence, you can consider certain lifestyle and dietary changes which may improve your nausea. Consider avoiding having a completely empty stomach, as feeling hungry may add nausea. Consider eating smaller and more frequent meals to avoid an overly full stomach. Try to avoid mixing liquid and solid foods and separate them by at least 30 minutes. Consider avoiding cold or overly sweet beverages, and avoid foods high in fat or with strong odors. Consider foods with protein-dominant nutrients that are dry or salty. Avoid triggers for nausea and vomiting, which may include heat, noise, humid places, and strong odors. You should keep a diary to note which foods or triggers make you nauseated and what foods you can tolerate, as every person and pregnancy is different. There are also certain things that can help relieve nausea, such as trying ginger-containing foods. Medications to help with nausea include vitamin B6 alone or with combination with doxylamine. It is important to note that this medication does not work right away and is most effective if taken regularly. Once your nausea is controlled, you can slowly decrease the dosage. Iron supplements may also cause you to have increased nausea. If this is the case, you may choose to temporarily stop it or consider substituting for another vitamin supplement that is low in iron. Fatigue can also worsen nausea, and you may find yourself in need of more sleep in early pregnancy, so it's important to get a good night's sleep. This sometimes may require having shorter working days and taking more breaks. Uncommonly, some women may have extreme nausea and vomiting called hyperemesis gravidarum that causes them to be unable to eat meals, to lose significant weight, and to have difficulty doing their daily activities. This condition requires immediate attention and evaluation by a doctor and usually requires other anti-nausea medication that is safe to use in pregnancy. Please note if your nausea and vomiting are not well controlled, especially if accompanied by abdominal pain, this may be due to another cause and you should seek medical attention if this is the case. If you have heartburn or acid reflux during pregnancy, you can try to avoid greasy or spicy foods, tomatoes, highly acidic foods, or caffeine. You can also avoid lying down immediately after eating a meal. If this doesn't improve, then you may need to take medications such as an antacid, an H2 blocker, or proton pump inhibitors. Pregnancy may cause you to be more constipated, which can be present in as high as 70% of pregnant women. With constipation, you may be more prone to having hemorrhoids, which may cause bleeding or pain in the rectal region. The key to treating constipation is preventing it. Lots of fluid, foods with bran, prunes, fruits and vegetables with fiber, stool softeners, and even exercise may help. As your belly grows in size, you may feel unwell, dizzy, feel that your heart is racing, have difficulty breathing, or even pass out when lying flat on your back. This is normal, as in this position, your growing uterus may put pressure on a large important vein called the inferior vena cava, thus making you feel unwell. To avoid this, you can do a couple of things. Place several pillows under your head and neck to elevate your back, lie on your side, or put a pillow on the right side so that you can avoid sleeping completely flat. Up to 70% of women may experience mild shortness of breath. This feeling that begins early in pregnancy is suspected to be related to the hormone progesterone. But don't worry, this feeling stays the same or improves as the pregnancy progresses. It should not interfere with daily activities, and if it does, you should see a doctor to make sure there are no other serious problems. You may also note changes in the appearance of your skin and certain body parts. you may see an increased darkening of the skin on the nipple, a dark vertical line below your belly button, or other dark irregular patches found around the face. Your breasts will grow during the pregnancy and may feel swollen and tender, especially in the first trimester. It's important to find bras that will fit well and have good support. Leg cramping and back pain are also common. Leg cramps occur in a third of women, and there are certain medications you can try to decrease the cramps, such as magnesium lactate or citrate. Make sure you hydrate well and perform stretches. Back pain is also common during pregnancy given the weight gain, the change in your center of gravity, and changes in muscles and ligaments due to hormones. Exercise that may help improve your back pain include aqua fitness, other pregnancy-specific exercises, or physiotherapy. Unfortunately, pregnant patients have a higher risk than average of developing blood clots in the legs called deep vein thrombosis or a DVT. This may present with leg swelling, pain, redness, or tingling that is worse on one side compared to the other. If a DVT is left untreated, it can travel to the lungs and cause life-threatening difficulty with breathing. Therefore, it is important that you do not stay completely bedridden for very long periods of time, and be wary of staying seated on very long flights or very long car rides. If you do need to travel for long periods of time, you should get up every hour or so to improve your circulation in your legs. Also, you should not travel if you anticipate the need for medical attention, especially if your pregnancy is of higher risk. You should not travel late in your pregnancy in the event that you go into labor or break your water early. Most airlines discourage travel after 32 weeks and cruise ships by 24 weeks. Your kidneys, which are responsible for filtering your blood, will receive more blood flow than usual. This may cause you to require higher doses of certain medication, and your doctor will be responsible for adjusting the dosages. You will also feel that you may need to go urinate more frequently. This is completely normal and should stabilize in pregnancy. If you feel that the urination frequency increases or is accompanied by fever, abdominal or back pain, or burning, please seek medical attention, as this may be a urinary tract infection. In general, your pregnancy will demand more nutrients to support the baby. Therefore, you may become mildly anemic and have lower iron body stores. Often, this anemia will be well treated with iron supplements and will resolve after your delivery, if not earlier.